Hi, and welcome to another episode of Double Doc Talk. I'm Dr. Ben Boudreau.
And I'm Dr. Clayton Roach. We are talking today about 5 quick facts about sciatic pain.
Yes.
Pain's not fun, and the sciatic pain is not fun. I think it brings it up a certain level. By the way, 40% of people will suffer from sciatic pain.
Absolutely. At some point, 40% of folks will suffer from sciatic pain. And honestly, sciatica is not a diagnosis at all.
Yeah, so here's quick facts number 1, right?
Yep.
That's sciatica, not a diagnosis. So what is it? When people say they have sciatica, it's really a group of
symptoms,
yeah.
Right? So it's a group of feelings and sensations that you get from the pain that comes from that sciatic nerve. So not necessarily a diagnosis. Sciatica can be caused by multiple different diagnoses. However, the symptoms that you experience are what people call that sciatica.
Yeah, so that typical leg pain, numbness, tingling, weakness, those are the symptoms that make up a sciatica, not really diagnosis, but just a group of symptoms. Number 2 quick fact about sciatic pain is that the level does matter. So in other words, where's that dysfunction in the spine from L3, L4, L5, S1, S2, S3, all the way down? Where's the dysfunction? You know, if you have something wrong with the spine, it's important for us to know where that is and that you're diagnosed properly, because that diagnosis will probably dictate what kind of symptoms you are going to have, and more importantly, what treatment you should be getting.
Exactly, and where, in fact, that nerve pain is coming from, right? So most people think, oh, I've got sciatica, so the problem has to be in my leg because that's where I'm feeling the problem.
Yeah.
But really, the sciatica, or where the diagnosis should be made, is in through your lower back, and then following the nerve down and figuring out, okay, well, where is it being compressed along that root of the nerve?
Yeah, it's a great point. So number 3, quick fact about sciatic pain is that you have a higher risk if you're taller. So we will never have an issue. Right?
Oh, so the higher you are, the higher your
exactly.
risk. So is 6'1",
yeah, 6'1" or higher, more risk of having sciatica, as well as weight and age.
Okay.
Yeah, so okay. The heavier you are, the more likely you are to suffer some severe consequences from a disc bulge in your lower back, creating sciatica.
Great.
Number 4 quick fact of sciatic pain.
Yeah, so the treatment depends on the cause. So like we said before, you know, it depends where that sciatic nerve is being irritated that's causing that sciatic-like symptom. Is it coming from your lower back? Or is it coming from a nerve being compressed in that track along the nerve, right? Yep. Or is there anything more sinister going on? Do we have to do further investigation? So it really depends on the diagnosis of that sciatica, what it is, how the treatment is going to be rendered at that point.
And like we said in quick fact number 1, like sciatica is not a diagnosis, it's a symptom. So, you know, the symptoms could vary a lot based on what that actual cause is. And we actually have like a cause of sciatica that's really not great, which, you know, in some cases could be cancer, right? So we need to make sure that we identify what the cause of the issue is, so that way you can get the best treatment for that particular cause.
Absolutely.
Number 5 quick fact about sciatic pain is that movement is life, right? So exercise is better than rest. You know, remember when, you know, people would have back pain, they would prescribe bed rest, and we're like, as chiropractors, like, oh my gosh, you know, why do that?
Moving, right?
Yeah, keep the joint moving. Yeah. So maybe we can talk about that.
And honestly, keep the nerve moving.
Exactly.
Right? And oftentimes we do, as chiropractors, we will prescribe exercise, or get our patients to perform some exercise to help mobilize that nerve, or maybe even stabilize the core a bit better. Maybe they have a pelvic issue that's causing that malalignment, and then compression on the nerve, leading to that sciatic-like pain. And so exercise, movement, is always better to get that nerve. Motion is lotion.
Yeah, and as you're getting those exercise, we as chiropractors will move the joint intersegmentally so that we're able to move that area where the cause is, if it's L4, L5 or L5, S1, along with those exercises, you could be out of pain in no time. So here you got the 5 quick facts about sciatic pain. Number 1, sciatica is not a diagnosis, it's just basically a group of symptoms. Number 2,
the level of irritation matters. So where that nerve compression is happening, L3 all the way to S3.
Yep. Number 3 quick fact about sciatic pain is that your risk increases the taller you are, with your age, and with your weight.
Number 4 sciatica fact is treatment depends on the cause of the sciatic pain.
And number 5, if you don't use it, you lose it. So exercising is better than rest. And here you have it. Another episode of Double Doc Talk with myself, Dr. Clayton Roach.
And I'm Dr. Boudreau. Don't forget to follow us on YouTube or subscribe to us on Facebook and Instagram and Twitter, and look for more great videos that we'll be releasing in the future.
Yep, take care and hope to see you on our next episode.